So first, we are joined by Angelica Urot. So Angelica, to tell a little bit about Angelica, she is a youth volunteer from the Family Planning Organization of the Philippines. She is a young volunteer who advocates with FPOP Surigao chapter, where she leads the efforts to raise awareness on key issues such as HIV/AIDS, teenage pregnancy, gender, SRHR, and leadership in stable and humanitarian crises. She has experience in supporting typhoon death response, where she supported the SRHR services and support to affected youth. So now I would like ask a few questions from Angelica. So how was your experience in contributing to a preparedness plan in emergency?
Okay, so as one of the youth volunteer of the Family Planning Organization of the Philippines, I have had the privilege in contributing to the emergency preparedness plans in various capacities, one of which the Typhoon Odette that happened in the Philippines last December 2021. And this experience is personal to me as I am one of the victim of the typhoon. Our area was directly hit and we were one of the victims of the devastation. So, but still, we are determined to deliver the services. We ensure that women and pregnant individuals still have access to sexual reproductive health services. We distributed safety, hygiene, and maternity kits, and we did discussions and lectures on sexual reproductive health, sexual and gender-based violence, HIV and AIDS, and we also worked closely with the affected youth to address mental health concerns. And I've seen firsthand the importance of timely intervention, especially to the youth and women during crisis.
Thank you, Angelica, for sharing your insight on that. So, can you also give us examples on practical activities of engaging adolescents and young people in SRH and SGBV in preparedness plans?
So one of the activities that we implemented is conducting community-based discussions and advocacy efforts that focus on sexual reproductive health, sexual and gender-based violence, and these activities are tailored to the adolescents and young people to provide them vital, accessible information. And most importantly, we create safe and open spaces for them to share their concerns and experiences because we see this as a very crucial thing because it ensures that we are able to build trust and ensure that these people have the right support during crisis. And on top of that, we also recruit youth volunteers who are passionate in contributing to sexual reproductive health and sexual and gender-based violence preparedness plans. So these volunteers undergo thorough orientation process that prepares them to join our outreach. And during emergencies, these volunteers play a very crucial role in ensuring that sexual reproductive health services are accessible to those who are most vulnerable. And in addition to the outreach, we also we organize youth-led programs where we collaborate with young people, and we make sure that we tailor our activities to their needs and their experiences. And aside from that, we also closely collaborate with the local government to as a key element in our approach. Like together, we implement referral systems to SJBV survivors and to ensure that they have access to medical, legal, and psychological support. Because during emergencies, these are the very important things that we have to give attention to because these survivors, we wanted to create safe spaces for them to be so that they can report incidents, seek help without any fear of stigma or judgment. And this holistic approach that we do with the youth and with the engagement of the youth ensures that no one is left behind. And with young people collaborating and engaging, we are able to create a safer and more supportive environment where everyone is given attention to and given the needs and services that they need during a crisis.
Thank you, Angelica. And it's really important that you highlighted that you should never leave anybody behind. So, going on to the next question, what are the lessons learned that you can share with us about engaging youth and young people, to sensitize them and all of that during preparedness planning?
So one of the important lessons that we learned in engaging young people in the emergency preparedness plan is the importance of youth-friendly communication. Because we know every youth here knows that we respond better to communications that we find effective, that we find engaging, relatable, and that are easy to understand. That's why it is very important, and we really give emphasis on the materials that we create, that it would connect to them, to their cultural and social backgrounds. Because when we tailor our communication to fit their context, we are able to empower young people to understand important topics related to sexual reproductive health and sex and gender based violence. And in addition, we also learned the importance of providing supportive environment for young leaders. And support can come in various ways, may it be for mentorship, access to material, or just simply creating a safe space for them to share their acknowledge their ideas that resonates with their peers, because we know this will lead to a more meaningful conversation on sensitive topics. And another is that we should be responsive and flexible to the changing needs of the adolescents and young people. So issues surrounding sexual reproductive health and sexual and gender-based violence are constantly evolving due to a lot of factors, cultural, social, and environmental factors. So by staying aware of these changes and being willing to adjust our strategies to fit their needs, we can ensure that our efforts remain relevant and effective. And so by applying these principles, we can better engage and inform our young people on our approaches on sexual reproductive health, one that leads to a more successful outcomes.
Thank you, Mahalakshmi. So let me share another question across the panel. What is your vision for the future leadership of youth in SRH in humanitarian settings? How would you envision how the youth would interact in the humanitarian settings in the future?
So my vision for the youth leadership, young people in and adolescents in sexual reproductive health, is one where young people are not just mere beneficiaries of the programs, but they are actively shaping policies and initiatives. And I see a future where youth leadership is fully integrated into the decision-making processes at every level, ensuring that sexual reproductive health is responsive to the needs of the adolescents. And by empowering young people and adolescents to take leadership roles, we can ensure, or we can create a more inclusive and sustainable future, one that prioritizes equity, education, and accessibility.